Good morning, everyone. Thanks very much for a nice early start to this meeting about access to COVID-19 vaccines within the occupied Palestinian territories and the growing inequalities due to lack of access. I particularly want to welcome MP colleagues from across the House of Commons, but also colleagues from other parliaments, including Sandra White from Holyrood and Thomas Hammerberg, who've joined us, and indeed others who may be coming on because we have a few others from European parliaments who have joined us this morning as well. Many of you know of my interest and engagement with Palestine. I worked as a volunteer in Gaza in 1991 and 1992 for medical aid for Palestinians, and after 2016 have worked with them to set up a Scotland-Palestine medical bridge with Gaza, East Jerusalem and the West Bank, initially around breast cancer, which is my background. I'm a breast cancer surgeon, but now also colorectal surgery. The breast cancer team do a meeting with Gaza at 7 o'clock on a Tuesday morning, which is a bit fierce, over Zoom to discuss and plan the treatment for all of the breast cancer patients diagnosed in Shifa and Nasser Hospital every week. And that, what we have seen is an absolute transformation in the caliber of treatment, in the organization of treatment for breast cancer patients in Gaza. So there's a lot that's going on, but what's very clear to me is last week in our multidisciplinary meeting, we had 2 women, not particularly elderly, but their CT staging scans showing scarring and damage from COVID. There's probably not been a week in recent time where we've not had at least one member of the team missing, either infected by COVID, quite a number of them, due to difficulties around PPE or isolating. And the problem is, of course, in Gaza, they managed to keep COVID out initially because of the blockade. So for once, Gaza's position of being sealed off was actually giving them some protection. They used schools as quarantine. But the moment COVID got into Gaza, it is so overcrowded and so packed, it just has gone like wildfire. And the problem is it's not as easy for people to isolate at home when they have a lockdown. You can't drink the water in Gaza anymore. So even not just going out for food or being able to stockpile a few weeks of food in your house, you need to go to access water. So it's incredibly difficult to manage in either of the occupied territories, but particularly in Gaza. And what we've seen is, while the world is applauding Israel for how quickly they are vaccinating their population, they're not honoring their responsibility to ensure that the Palestinian population in the occupied territories are also vaccinated. And we even had a couple of weeks ago the hint that in exchange for a couple of thousand doses for medical staff, they were going to negotiate with the administration in Gaza before handing them over. And obviously that's something that we really don't want to see anywhere. It's a simple fact that this is a global pandemic and no one is safe until everyone is safe. And that particularly applies to people within Israel, which is of course closely cheek by jowl with the occupied territories. So it doesn't make any sense, and it is certainly not humanitarian. So we're now going to hear from several speakers to look at this issue. And the first is Dr. Ben Bouquet, who's also a medic like myself, but he's a public health specialist and works around public health and human rights for the WHO in the occupied Palestinian territories. So if I can hand over to you, Ben, and he'll speak to us for about 8 minutes.
Great, thanks very much, Philippa. Are you seeing my presentation there?
We are, yes.
Okay, I'll just make that full. Yeah, so good morning, everyone, and thanks for the introduction. Yeah, so my name is Ben. I work with WHO as a technical officer in public health and human rights. And this morning, I'm just going to discuss some of the structural challenges to the public health response in COVID-19 to COVID-19 in the occupied Palestinian territory before we hear in more depth from different speakers on different areas. I'll just very quickly touch on in the introduction the issue of health inequities, which underpins our discussion on structural barriers, before looking at WHO health system building blocks, and we'll focus specifically on challenges to governance, financing, and services delivery. So health inequities are defined by WHO as systematic differences in health outcomes that result from the political, economic, and social conditions in which people are born, grow, live, work, and age. They are unjust, and they point to barriers to the right to the highest attainable standard of health. And you can see evidence for structural barriers or structural inequities in the differences in health outcomes, and with life expectancy in occupied Palestinian territory around 8 years lower than in Israel, infant mortality, under 5 mortality, and maternal mortality all many-fold higher as well. Health system building blocks as defined by WHO, there are 6, and in this presentation, as I mentioned already, I'll just be looking at leadership and governance, financing, and services delivery. So governance challenges, you have the production of humanitarian needs, which have arisen from chronic displacement and refugeehood, with a significant role for UNRWA in humanitarian provision of healthcare, long-term occupation, blockade, and political division, and fragmented responsibilities, which I know that Itan will be exploring in more depth in his presentation. But overall, you have, as Philippa already mentioned, Israel as an occupying power has responsibilities for the public health and healthcare provision for the Palestinian population. The Palestinian Authority was transferred responsibilities under the Oslo Accords for public health and healthcare. The de facto authority in the Gaza Strip has responsibilities in its administration of government functions, and third states of the international community have responsibilities under international law. And different parts of the occupied Palestinian territory, such as Gaza Strip versus, let's say, Area C of the West Bank, there will be different responsibilities due to the different effective control of the duty bearers. Protection gaps exist in the occupied Palestinian territory, and these have specific effect on healthcare and public health. These are evidenced by denial and delay of health access for patients and for health workers, securitization of health access, where you have the arrest, interrogation of patients and companions, as well as health workers, attacks against healthcare, and shrinking humanitarian space, particularly in certain areas which are under the direct control of Israel, such as in East Jerusalem and Area C. And this is underpinned by lack of or weak accountability mechanisms, both locally, nationally, and internationally. And then all of these sort of structural barriers affect the implementation of, or the effective implementation of health policies. So at all levels of the health system, you can see barriers to transparency, participation, and equity, particularly when it comes to some of those more vulnerable populations in Area C, East Jerusalem, Hebron. In terms of financing, the system for financing in the occupied Palestinian territory is actually probably more similar to our National Health Service, in the sense that you have an overall high dependence on governmental provision. Although it accounts only for 40% of total spending, most of the population is highly dependent on the public provision of healthcare, with only 12% of the health expenditure or the health budget derived from insurance contributions. Overall, you have a very high level of donor dependency, and so this even affects public expenditure, of which 12% of the public healthcare budget is derived from international donor contributions. And then the importance of emphasizing the role of the government in terms of stewardship, but also in terms of financing of healthcare, is that healthcare is then directly affected by some of the barriers to revenue raising, which arise from lack of control over natural resources, lack of control over tax revenues, with 2/3 of tax revenues dependent on reimbursement from Israel and withholding of those revenues on certain occasions, accumulating to a fiscal leakage of 3.7% of Palestinian GDP. And then high levels of unemployment then, of course, affect income taxation, which also affects the financing of the health system. And these structural vulnerabilities then have manifested in the recent precipitation of fiscal crises in 2019 and 2020. 2019 in the context of refusal of reduced tax revenues by the Palestinian Authority from Israel, and in 2020 with the end to coordination with the threat of further annexation in the West Bank. And as mentioned, this impacts on all areas of health expenditure. So these principally are the healthcare workforce, provision of essential medicines and supplies, and then purchasing of services from outside providers, which the Palestinian health system is very dependent on due to lack of availability in the public system. Very quickly, in terms of health workforce challenges structurally, we can see that the number of nurses and midwives falls below the WHO suggested threshold, and the composite indicator for nurses, midwives, doctors, dentists, and pharmacists also falls below the international benchmark. And you can see in certain specialties, there is a higher shortage and lack of certain human resources, which drives the reliance, excuse me, on outside provision. This graph just gives you an indication of the long-term lack of supplies of essential medicines and supplies in the Gaza Strip. And those essential medicines lack has really jumped in the past 3 years, exceeding 45% in 2018 and 2019. These are the pillars of the national preparedness and response for COVID-19. And so we already touched on the governance aspects around which obviously affect then coordination, planning and monitoring and control at points of entry, which Philippa also touched on. And then in terms of supplies, this also has affected supplies for laboratories, infection prevention and control, and case management. There were certain critical shortages for laboratories, for example, in December, when there was really the peak of cases in the Gaza Strip and West Bank. The positivity rate for testing at that stage exceeded 33%, exceeded a third. So a third of all tests that were being carried out were positive, and that gives an indication of the lack of supplies at that stage. Similarly, for infection prevention and control, what has been documented is that more than 4,000 healthcare workers have been affected with COVID-19, and that's just the documented cases, as Philippa already mentioned, on an anecdotal level. And then case management has actually been relatively effective in securing additional oxygen ventilators, for example, and the prevention efforts have stopped an overwhelming of the health system and an overwhelming of critical care beds. But what has really been badly affected is the maintenance of access to essential health services, which is an exacerbation of the structural barriers to access that have already underpinned the health system in the West Bank and Gaza Strip. This diagram just gives you an indication of the bureaucratic hurdles that a patient will face in their pathway to accessing essential health services. So getting a financial approval and medical approval from the Ministry of Health, then applying for the permit system through the permit system, which is extremely unpredictable, and then having to wait for the outcome, and if successful, crossing errors, and all of these steps requiring coordination and bureaucratic administration. So you can see that 2/3 of the referrals from the Gaza Strip are to the West Bank, including East Jerusalem, and more than 1/3 of applications by patients in 2019 were either delayed, accounting for more than 1/4, or denied, almost 1 in 10. And this, just to finish, is a story of a girl who's Jana, who's 3 years old. We at WHO met her back in February 2020, so before the outbreak of COVID-19 in Palestine. Already the structural barriers to access existed. She had surgery in Gaza Strip for a cancer called a rhabdomyosarcoma and underwent chemotherapy in the Gaza Strip. But she needed radiotherapy, which wasn't available, and she was referred to Augusta Victoria Hospital in East Jerusalem. She made 3 permit applications, which were all delayed. So it delayed her access to radiotherapy for over 5 months. And her mother was also denied 1 application. After advocacy, she received a permit on the 15th of February 2020. And her mother stated then that she jumped up from the bed to the floor and started shouting. She was so happy, as if she had won a 1,000 dinar prize. So this is the reaction to actually just being granted your right of access to essential healthcare services. And we at WHO did a retrospective look at patients who'd been referred for chemotherapy and radiotherapy from 2008 to 2017. We found that from 2015 to 2017, patients who were initially delayed or denied their permit applications were 1.5 times less likely to survive in subsequent months and years. And linking back to the discussion about shrinking a humanitarian space, also shrinking space to even talk about issues on Palestine, we've been struggling to get that paper, which has been one that's led by very senior researchers in WHO, it's been under peer review now for around 1.5 years. So that's it from me. So, and just in conclusion, humanitarian needs and vulnerabilities driven by the situation, the political situation. There's been successful preventing of overwhelming of the healthcare system, but critical shortages at different stages in the outbreak. And then the issue of maintaining access to essential services has really been exacerbated, and COVID-19 has exposed some of those structural inequities which were already present in the health system. Thank you.
Thank you very much, Ben, for such a kind of comprehensive and detailed picture for everyone. If we can just move straight on now to Najila Shawa, who works for Oxfam as a food security and livelihoods manager, and who actually had 11 years of experience being involved in relief and developmental programs in Gaza. So over to yourself, Najila.
Hi, it's Najla. Thank you, Philippa. And you know, just to follow on the first presentation by Ben, I think what does it really mean for an ordinary person to get decent healthcare? It will cost a lot, if not a life. And for just very simple things, it costs a lot of money. And the situation in Gaza, to remind everyone, 2 million people living in the Gaza Strip, over 50% of the population live under poverty. This is already pre-COVID, and imagining how many layers of additional challenges have come over this population that is already suffering blockade, internal division, internal Palestinian division, all kinds of pressure, restrictions on movement of Palestinians from both from Israel side and from Egypt. So the list goes on, and I think now looking at what does that really mean under COVID, I think that it's impossible, as Philippa said, it's impossible to isolate, it's impossible to be protected, no matter how much measures are put in place. However, these measures, when they were put in place, they were obviously, as many places in the world, however, more heavily affecting the Gaza Strip, has just left no chance for people to earn living. The majority of the population already depend on humanitarian aid, and this has been extremely impactful over the situation of children and also women, causing more and more fragmentation, more and more tension, violence, even gender-based violence, domestic violence, etc., etc. When people can't afford to eat, for sure they will not be able to buy PPEs. For sure they will prefer to feed their children over buying a mask or a sanitizer. So you can imagine how things have been impacting and the level of effort that is needed to support the population to just survive. Now for Gaza, in addition to the list that I've mentioned of the challenges, the need to highlight is the internal division that has caused enormous effect on even our ability as humanitarian organizations to address the basic needs of the population. Things are in the field completely, extremely complicated due to this lack of proper coordination. Maybe when it comes to COVID, there was some, but very limited coordination. And I think Gaza, it's very obvious that Gaza is not even getting the right or the proper share of resources, of resources for COVID or in general for health resources, materials, pharmaceuticals, etc. Needless to say that currently this political situation is also impacting, is also seen as an opportunity for Palestinians to stay together. However, we cannot deny the importance of the international community's role on how to really support, especially the current efforts with regards to the upcoming elections. People have their doubts about the elections and the outcomes, or whether they're going to happen or not. However, it's a must, and it's an urgent call for all governments to really put all the pressure possible on reconciliation efforts, to really try to minimize this great damage that we have been witnessing, we have been suffering, that the population has been suffering for many, many years. After 15 years, so there would be in elections, I think that's really the opportunity that even the no contact policy that must be abolished, to really respect and support reconciliation, and respect also the needs of the population that are just going beyond what is normal from before. I think Palestinian unity is not only an important element for reaching a fair and just solution to the conflict, but it's just fundamental to improve the situation of people on the ground. I think I can close with that. Thank you very much.
Thank you very much, Najila. If we move on now to Rohan Talbot, he's the Advocacy and Campaigns Manager at Medical Aid for Palestinians. And Rohan and I traveled together to Gaza in 2016 on our fact-finding visit with regards setting up the breast cancer project. We were incredibly grateful that our suitcases weren't searched at Ben Gurion, as one of them had 40 breast prostheses in it, and it would have been really quite difficult to explain exactly what we were planning to do with 40 rubber breasts coming through the Israeli airport. So handing over to you, Rohan.
Thank you very much, Philippa. And I still haven't learned either the Arabic or Hebrew for rubber breast, but maybe I will do at some point. Thank you everyone for joining us first thing on a Monday, and thank you to Ben and Najla, obviously associating myself with everything that they've said, and their fantastic contributions. And Dydd Gwal Dawi Sant Hapus, if there's anyone joining us from Wales as well. I'm going to give a brief overview of the COVID and vaccination situation today, and a few recommendations for action we think the UK could be taking to address it. As Ben and Najla have both described, the humanitarian situation in the OPT remains dire. And especially now, cases are once again surging, especially in the West Bank, fueled in part by the arrival of UK and South Africa variants of COVID, which follows the spike in December of cases, which really pushed the health system close to capacity. We understand that the positivity rates of tests now is around 25%, again, as Ben suggested, indicating under-testing and lack of capacity. And the Ministry of Health announced over the weekend that intensive care units are again surging towards capacity occupancy, and the PA has announced a 12-day lockdown. Obviously, I mean, as has been pointed out, the humanitarian impact of COVID can't just be assessed in terms of infections and deaths, but also all of the other knock-on effects in terms of knock-on effects on other healthcare provision, deepening poverty, food insecurity, etc. And our own partners in Gaza are reporting a surge in childhood malnutrition, which obviously can have lifelong effects. But not only that, the pressure on health workers themselves is really immense. And I just wanted to share a few quotes collected by my colleague Celine Jabber, who you'll see is on the call, who's been researching the impact of COVID on the mental health of health workers. A family doctor in Nablus told her recently, "Throughout my work amid the outbreak of COVID, I felt like I was drowning. On the one hand, I felt the risk of getting infected and infecting my family. On the other hand, no matter what you do, it's not enough. The number of infections is just too high." And an anesthesia technician in Hebron told her, "I and my colleagues felt emotionally drained after our work at the ICU. I remember I used to cry in every shift I had in the department, and I couldn't sleep at night. We did our best, but most of the patients who received mechanical ventilation died." And then also an oncologist in Gaza, we've just been hearing about the issues in Gaza as well, told her working during the outbreak of COVID-19 reminded me of my work during past wars in Gaza. No drugs, further restrictions on the movement of patients, and nothing to do for my cancer patients other than comforting them and giving them painkillers. So it's really clear that the health system and the economy can't sustain a long-term response amid the economic and other constraints of the occupation and in Gaza, the blockade. And so it's our belief as Medical Aid for Palestinians that only a program of mass vaccination can sustainably relieve the pressures on the health system and prevent further avoidable loss of life, spiraling poverty, and deeper health inequalities. So the vaccine situation today, I'm sure that you've heard bits and pieces from the media, but I'm going to try and pull it together here. Israel obviously has the world-leading vaccination program. It's vaccinated more than a third of its population with 2 doses and more than 50% with 1. They're already seeing a reduction in severe cases being reported, and their vaccination program covers Israeli citizens living in illegal West Bank settlements. It also covers Palestinians in East Jerusalem, though uptake is lower in part due to lack of trust in the Israeli authorities. In the OPT, the PA has received 2,000 doses of the Moderna vaccine from Israel, 10,000 Sputnik 5 doses from Russia. That together accounts for a fraction of a percent of the population, and the West Bank has already exhausted their doses, we understand. 2,000 of those doses have entered Gaza after a delay of a couple of days by Israel. That 2,000 would be enough for 0.05% of the population of Gaza, and another 20,000 of the Sputnik 5 have been donated by the UAE. So in total so far, we know that 4,800 people in the OPT have received a first dose. Now, Palestine has applied to the Global COVAX facility, which is generously supported by the UK, which will provide, I think, somewhere between 20 and 30% of the population, but that's probably going to take many months to be delivered in full. For example, there are supposed to be just over 37,000 doses of Pfizer and 240,000 doses of AstraZeneca in the coming weeks and months. Again, that in total would be enough for less than 5% of the population to receive 2 doses. It's also been reported that Israel and the PA have agreed to vaccinate the approximately 100,000 Palestinian workers entering Israel for construction and other work. Obviously, that's vaccination not on humanitarian terms, but on the basis of ensuring that there's less risk to Israelis and the continued availability of Palestinian workforce for Israeli industry. So everything that we've added up clearly shows that there is not a comprehensive, there is not a rapid, and there's not an equitable vaccination program. And the PA estimates that it's going to take the rest of the year to adequately vaccinate the whole population. I think some of you might have seen that the Associated Press last week was also repeating that the government of Israel was planning to provide 100,000 vaccines to countries, including Honduras, Chad, Czech Republic, etc., in exchange for diplomatic support. For example, encouraging the movement of embassies to Jerusalem. We understand that there's been some indication that that's actually been rolled back by the government of Israel in the last few days, which is obviously good because it would set a very dangerous precedent of vaccines being used as an extension of power and diplomatic power rather than as an essential humanitarian necessity. So in this deeply inequitable situation, just to illustrate how this is, a young, healthy teenager, an Israeli teenager living in a settlement, an illegal West Bank settlement, may be able to access a vaccine, but not an elderly or vulnerable Palestinian living on the same occupied land. And so the question is what the UK can do. I know that Etan's going to talk about obligations, so I won't go too far into this, but I do think it's worth just pointing out that there are concrete things that the UK can be doing to address this situation right now. Firstly, the UK should be reminding Israel of its duties as an occupying power to ensure the availability of vaccines and also monitor adherence to these duties. We noticed that at the Security Council last week, Ireland made a statement reminding Israel of its duties, and we think the UK should do the same. It should also be promoting accountability for violations of international law, including the blockade and closure of Gaza, and repeated attacks on health workers that have long undermined the capacity of the local healthcare system to be able to deal with infectious diseases such as COVID. It should also be urging the PA to ensure that it meets its duties to ensure vaccine stocks are equitably provided between the West Bank and Gaza, and support vaccine rollouts with technical or other assistance where it can. But there's also a long-term element to this as well, that the UK needs to seek to reform its aid support to the OPT, placing the principles of self-determination and sustainable development at the heart of aid, and ensure that Palestinians are meaningfully consulted in the process of developing aid initiatives. And finally, just in that last regard, I'll provide the link to this, but there was a recent study funded in part actually by UK Aid, conducted by Caitlin Proctor at the European University Institute of Florence and Jason Hart at the University of Bath and some other researchers that explored the experiences of communities in Gaza during the pandemic that really well highlighted the issues faced in self-isolating and social distancing, and the impact of the blockade on COVID response. Yeah, like I say, I'll provide a link because I really recommend having a look at that. I'll leave it there.
That would be great. Thanks very much, Rohan. And if we can move finally on to Eitan Diamond, who is manager and senior legal expert at Diakonia Center in Jerusalem, who's going to talk to us about the legal obligations under international humanitarian law that Israel has towards the Palestinians within the occupied territories. Now, just before he starts, I need to apologize that I'm going to have to leave at 15:15 because there's now a briefing with Matt Hancock regarding the arrival of the Brazilian variant in the UK, and as SNP health spokesperson, I'm going to have to attend. So Joseph will take over for chairing some of the Q&A for the last bit of the session. But if I can already thank all the speakers, as I won't get the chance to do so at the end, and all of you for attending. Over to you, Eitan.
Thanks very much, Philippa, and thank you all for joining us. I'm going to try to share my screen, and if that doesn't work, we have a contingency plan, but I think it is working. So yeah, so as was mentioned, I'm going to be talking about the responsibility under international law with respect to COVID-19 vaccines. And really there are three main authorities that each have a share of responsibility in this regard. First of all, Israel, as was mentioned by a few speakers. Second, the Palestinian Authority also has certain obligations, and I'll provide some detail about the nature of those obligations. And then the de facto authorities in Gaza, controlled by Hamas, also have a set of obligations. Now, the scope of legal obligations that each of these actors has is connected to the level of control that they each have over the territory and over its population. And obviously, Israel as an occupying power has the most control, and therefore also the most robust legal obligations. The obligations that each of these actors have is also dependent on the means and resources that they each have at their disposal. So they're obliged to do what they can do, not what they cannot. And obviously the more powerful actor here has the more robust obligations, and that again points to Israel. So just to turn for a moment to the legal frameworks that determine the scope of the obligations that these actors have. So there are two main bodies of international law that are relevant here. The first of these is international humanitarian law, or IHL as it's sometimes referred to because of its acronym. And IHL regulates the conduct of parties in hostilities, but it also has an area called the law of occupation, a subset of rules that applies in situations of occupation. And Israel, being an occupying power in the occupied Palestinian territory, is bound by this area of international humanitarian law and the obligations it imposes, including with respect to provision of medical services. In addition, international human rights law applies, and it applies not just in relation to Israel because of its influence and control over the territory and its people, but also to the PA and to the authorities in Gaza, and as we'll see, hopefully we'll have some time to touch on that, also to third states. Now, when we talk about obligations with respect to the vaccine, it's useful to sort of distinguish between different stages in the provision of the service. And a first set of obligations relates to supplying the vaccine. Now, when it comes to the obligations with respect to supply, then under IHL, and in particular under the law of occupation, Israel is subject to a number of obligations. First of all, there's a general obligation established in the law of occupation to ensure civil life, and civil life includes the right to health. More specifically, in Article 55 of the Fourth Geneva Convention, there's a provision that requires the occupying power to ensure medical supplies for the population of the occupied territory. So that's quite clearly applicable also to COVID-19 vaccines. And furthermore, when the occupying power itself fails to discharge its obligation to provide supplies of this nature, then it has to, at the very least, allow and facilitate the passage of medical supplies by others. This is established in Article 59 of the Fourth Geneva Convention. So those are obligations established in international humanitarian law. International human rights law also establishes relevant obligations. These are found derived primarily from Article 12 of the International Covenant of Economic, Social, and Cultural Rights, which establishes a right to health. And it obliges Israel to make the vaccines available to the population under its control. And it has to do so without discrimination. So, I mean, we were hearing before about the young settler who has access to the vaccine, and a person from an at-risk group, a Palestinian from an at-risk group, their nationality shouldn't be a factor in discharging this obligation. Israel should provide the vaccine on the basis of criteria such as medical need. And when it relies on criteria such as nationality amongst the people under its control, it's not discharging its obligations under international human rights law. I just move to the, okay. So there has been reference by a number of commentators to the Oslo Accords, and some Israeli officials or perhaps apologists for Israel have argued that the Oslo Accords absolve Israel from its obligations towards the Palestinians because there was this bilateral agreement that health services will be provided by the PA. But from the perspective of international law, bilateral agreements are really beside the point. They don't discharge they don't relieve, the occupying power of its obligations under international humanitarian law. So in the Oslo Accords, what was agreed basically was that Israel would discharge its obligations under the law of occupation by via the PA. So, and this is actually something that international humanitarian law encourages. It's very much in line with the right to self-determination of the population under occupation, that they should be able to run their own health services. And so they should have the first go, as it were, at providing services such as the provision of vaccines. But if the PA is for any reason unable to discharge that, to fulfill that function, then it remains Israel's obligation to ensure that the vaccines are provided. And the Oslo Accords do not relieve it of that obligation. So we've been speaking about supplying the vaccines, but then there is also a question of who has the obligations with respect to entry of the vaccines into the occupied Palestinian territory. And here again, since Israel controls the borders that lead into the West Bank and the Gaza Strip, it bears primary responsibility for ensuring safe and rapid entry of the vaccines. I should point out that other states have responsibilities along the way. So while the vaccines are traveling elsewhere, states should allow for them to go through as quickly and efficiently as possible. But certainly when it comes to the question of allowing the vaccines to go into a place like Gaza, then Israel has primary responsibility, and one can find legal sources to back this up again in the Fourth Geneva Convention in Article 59 that I mentioned before, and in Article 61 there. And so it mustn't hinder the passage of the vaccines, and it is in fact obliged to take positive steps to facilitate passage. So it shouldn't impose all kinds of burdensome administrative requirements, and should allow these goods to go through as quickly as possible. And as we've heard, that doesn't seem to be the case at the moment. So once the vaccines enter the territory, there's a question of who has the responsibility to actually distribute them within the territory, to, among other things, administer the vaccine to people, but to run the whole system that's necessary in order to facilitate this. And here there are obligations shared by a number of actors. So the PA is actually the actor that is responsible for establishing a vaccination plan for the occupied Palestinian territory. And then the PA, together with when it comes to Gaza at least, together with the de facto authorities in Gaza, is responsible for ensuring that the plan that they've devised is implemented as effectively and equitably as possible in accordance with international human rights law standards. So that, for example, would require that the vaccines are distributed in an equitable manner without any unnecessary or unjustifiable distinctions between people in the territory controlled by these two authorities. Israel, for its part, has an obligation to support the Palestinian authorities in their deployment of the vaccines. And it must do whatever it can to facilitate that. So there's an obligation under Article 56 of the Fourth Geneva Convention to cooperate with the local authorities. And that would mean, again, allowing and facilitating passage of the vaccines from the West Bank into Gaza. So if the PA is running a program that requires vaccines to be provided to Gaza, and they should be provided equitably, then Israel should facilitate that. And movement within the West Bank should be facilitated. And certainly Israel should refrain from hindering access and safe and effective vaccinations for Palestinians. Now, finally, and I'll try to do this quickly, third states, as I mentioned, do have some obligations. These derive primarily from international human rights law. First of all, what they're obliged to do is to operate to the maximum of their capacities to facilitate access to essential health goods and services. So it says Gazans here, but that would be for Palestinians in general. And this would include an obligation when it comes to vaccines. So to do what they can, this is an obligation of means to ensure that that the vaccines reach their destination in occupied Palestinian territory. They certainly must refrain from rendering any sort of aid or assistance in the commission of violations of international law that undermine access to vaccines. So, for example, there should be no assistance to any of the measures that Israel imposes, such as the blockade on Gaza or destruction of facilities in the West Bank that are important for providing vaccines. And in addition to providing any assistance to the commission of these violations, what third states should do, and this is again a question of how much influence they have, is to exert influence, the influence that they have on Israel, with a view to put an end to the violations and prevent any further violations of IHL being committed. This is a very fundamental obligation, actually, that states have to ensure respect for international humanitarian law. And ensuring respect in this case would mean, among other things, pressuring Israel, and we heard mentioned before of some ways in which that could be done, including by the UK, to cease to persist with these actions that entail a violation of its obligations and deprive people of access to these crucially needed vaccines. So I'll stop there, and I'd be happy to take questions if there are any later on. Thank you very much.
Thanks very much. That was great to hear that legal basis. I'm not quite away yet. The briefing's been changed to 10:30. Having gone out and come back in, I've lost access to the chat. So I don't know who all wanted to ask questions. So can I ask you to put them back in the chat again. I'm sorry for being such an inefficient chair. But the first one I can see is Jean Fitzpatrick, who wanted to ask, why is Israel not meeting its international obligation? It's clear that they should be doing that and that they must know that they have that responsibility. So that's one for you, Eitan. And if I can ask other people to put their questions back in the chat. I will still have to leave at past, and if you're still chatting, then Joseph will still take over.
Okay, so I'll try to quickly take that question. I think when it comes to obligations under international law, it's critical that there will be a response by the international community when members of the international community fail to discharge their obligations. If a violation is met with indifference or no effective response, often actors will be motivated to persist with these kinds of violations. So there's no cost for Israel in violating its obligations under international law, or minimal cost, and so it persists with these violations. So I think this obligation to ensure respect for IHL and for international law more broadly is an obligation that states, and particularly influential states, should do more to discharge.
I mean, obviously we see that even with UN resolutions, etc., we get a lot of talk, but we don't tend to get a lot of action. I mean, as was referred to earlier, the issue of people leaving Gaza to access medical treatment, because obviously breast cancer uses radiotherapy as such a pillar of treatment. We constantly have that issue of trying to get patients out of Gaza to Augusta Victoria to get the radiotherapy. Okay, the next question I have is from Sandra White, a colleague from Holyrood. Sandra, you'd like to ask a question?
Thank you very much, Philippa, and thank you all for organising this. It's been very interesting.
Oh, I didn't do the organising, as you well know, Sandra. I just pitched up.
I would like to ask the question of everyone, but obviously time is of the essence. I'm the convener of the cross-party group Palestine in the Scottish Parliament, and Etan's absolutely correct. Whenever we raise a question about the vaccinations, we are told the Oslo Accord, and basically Israel doesn't have to do that. So it was great to see your slides, and I would, ask if we could get any information sent by email, slides, etc. So Palestinian Authority, how do we push that, push the issue, which every time you raise it in questions or debate regarding its Palestinian authorities or it's Hamas that stops the vaccinations from getting through? That's what we get all of the time. And the other question I wanted to ask is the role of the European community or the EU in this, because obviously, I mean, I've been over in Gaza as well, as Philippa knows, and the West Bank also, and trying to get anything through at all, medical equipment even, is very difficult. And now Israel is embedding itself in the EU, that lots of equipment's not able to get over to Palestine simply because they will take various pieces out of the equipments, etc., to say that they can be made for bomb making or whatever it is. So I just throw that out. Maybe perhaps Etan's not the person to answer that, but I'll throw it out anyway. Thank you. Thanks, Philip, for allowing me to ask that.
I don't know, we could probably only have a response from one, so whoever feels they're best placed to answer that. I don't know whether that would be yourself, Ben, because you were talking about the difficulty in getting things in, and then if Eitan has anything specifically to add to it, but if we can keep it short.
Sure, yeah. I mean, on the responsibilities, definitely I'd defer to Eitan. I think that's certainly his area. But the dual use list that Sandra mentioned, I mean, yeah, this has definitely an impact on the provision of healthcare. Not only kind of what can get in and out, but also all of the procedures around getting things in and out, which have, tend to contribute to delays in access. Also, if you need spare parts, for example, I mean, we did an assessment on this. If an MRI machine is not functioning and then needs a spare part, it can take months, and you're just left without a functioning machine because it's getting access to the expertise and being able to analyze what the problem is, and then having to send multiple parts to then get multiple parts in return, knowing that all of these delays are going to happen, which also adds to the cost. So yeah, the impact of this dual use system is manifold. I think it's hard to say that any specific medicines. People are often looking for things like that. We can say that certain materials that are used in limb prostheses have not been able to get in, or are certainly on the dual-use list where they faced delays. Nuclear medicine scanning is something that just will never be available in Gaza. And of course, the dual-use list is more stringent for the Gaza Strip than it is for the West Bank as well. So that then has an impact on equity. But that's over from my side, Itan, if you wanted to.
Thanks, Ben. I mean, one of the bizarre things when I was last out in Gaza is that they actually have a nuclear medicine scanner, but can't actually access the radioisotopes, which shows you the failure sometimes of donating bodies to actually liaise with their partners in the occupied territories to look at what is usable. I don't mean it is right that they can't access radioisotopes, but using something like an expensive gamma camera simply as a medical couch is a waste of everybody's money and effort. Could have been spent on something else. I don't know whether, Eitan, you have anything else you want to add on that?
So perhaps what might be useful is just to point out, and I'll put a link to it here, is that we prepared a sort of Q&A on questions about vaccines, and they address in a bit more detail than I'd probably be able to do now, but in a, I hope, user-friendly way, some of the questions that were raised now. Certainly, I mean, I did try to emphasize in my talk that imposing overburdensome administrative and procedural requirements on the movement of goods into Gaza, including vaccines, that are needed for coping with COVID-19 is something that is very difficult to reconcile with, well, I'd rather say it's impossible to reconcile with Israel's obligations under international law. So it can impose certain restrictions that are needed for security purposes, but the sort of use of these expansive dual-use lists doesn't reflect genuine security needs, and certainly it's completely disproportionate the way they're interpreting their security needs at the expense of basically millions of people in Gaza who don't have access to crucially needed goods.
I think also the diagram that we saw earlier about all of the stages of getting permission to travel for medical treatment, and frankly, of my experience in Gaza, it was optimistic, talking about 7 to 30 days to get permission, where in actual fact we have a big percentage, you just never hear anything. We have others where 6 months later you're still trying to get them away for radiotherapy, and the timing of all these therapies within the management of breast cancer is actually quite important. So, you know, we see this all the time, that you have this huge administrative barrier, and you're sometimes talking about, you know, a 72-year-old woman. You know, I mean, the security threat that she's likely to pose, it's just ridiculous to put her in that space. Now, before we finish, Chion Wara had put 2 questions in the chat. Now, one was talking about it would be useful to have a summary of what the UK should be doing. And I would say that to all of you, and maybe someone, maybe Joseph could coordinate that. We can put in written questions, but also, you know, obviously in the Foreign Office, etc., we can raise different issues or raise them in debate. So it would be good to spell out a few key points in an email to everyone who's attended this morning. What should we be asking? What should we be pressing about? And who is it we should be asking it of? I think that would be helpful to all the parliamentarians. And I think it was yourself, Ben, that you said that you'd had difficulty getting a paper published over really about 18 months. Now, I know from my years as a breast cancer researcher, getting papers published isn't easy, but the impression was that you feel that there's an actual blockage there. In what way is that? How would Israel be able to stop you getting an academic or public health paper published?
Sure. So, I mean, it's not that Israel is itself interfering, it's more the hesitancy and wanting to say anything on Palestine at the moment, particularly in some of the major medical journals. And I think, as you say, of course, it's not simple to get a paper published. And there are 2 aspects of the review. One is the technical aspect of the review, and then the other is the, let's say, the editorial part. And all instances we've been denied on the editorial basis and not on any grounds of of the technicality of the research that was carried out. So we were denied by 2 major journals, which wasn't, I also think that it could have also happened to other papers. It's not necessarily the case that it's just related to Palestine. But here, I mean, now I think we're on the 5th journal. We've been waiting a year. I think that it's essentially stalling. We had already the technical review. It keeps going through different phases of the editorial process. And we even received feedback from 2 major journals that said that this was too niche a paper for their journal. I just think if we had done a study looking at the impact of a UK policy on UK cancer patients that showed that that policy increased the chance that, reduced the chance of survival by 1.5 times, I don't think that we would be struggling in any way to get this paper published. And I think that gives an insight into the difficulty in talking about Palestine at the moment. And it's not an isolated case. I mean, I can also refer to the paper by David Mills at Harvard and colleagues that was a letter published in Lancet, which was then retracted after pressure was put on the editorial team. And so I think this is something that's being seen across the board, and it's not an isolated case by any instance.
Yeah, I think many of the people on the call here today will have experienced that kind of downward pressure on simply discussion of the issues, which is, doesn't actually help anywhere towards resolution. Okay, well, basically, I don't see any other questions in the chat. So the time, actually, I've managed to hang in here till the end. And I would just, again, like to thank all of our speakers. I'd like to thank Joseph for all the organization and all of you who have attended. Clearly, this is not going to be, oh, sorry, I'm told that, Jeremy, you had a question. I thought it was just, oh, sorry, you wanted to ask about the refugee camps, supplies to the refugee camps in Jordan, right, Lebanon, and Syria. If there's anyone who wants to answer that for Jeremy. Rohan, you could maybe cover that quickly.
Sure. Yeah, just briefly, it's a good question. And obviously, as MAP, we've got a presence in Lebanon, so it's easy enough to say. I can't speak much about Syria. I don't think they have much of a vaccination program at the moment. I know that in Jordan, Palestinian refugees can access vaccines. Officially in Lebanon, their vaccination program, I think, is underwritten to a certain extent at the moment by the World Bank with certain stipulations. And that includes that Palestinian and Syrian refugees who are in the country be allowed equitable access to it. And as far as we understand, actually, there's an agreement with UNRWA and UNHCR to enable refugees to be able to register for the vaccine. So it's done on the basis of vulnerability and need, rather than the basis for nationality, which is exactly what we would want to see. One thing I will say, and I'll just put the link in, is that there is a lower uptake of registration amongst Palestinian and Syrian refugees, probably indicating less trust in the government for obvious and understandable reasons in Lebanon. So it's a good question, but actually, at least officially, they can register for vaccine.
I think that even that is a useful contrast, Rohan. So again, as I say, if our speakers working with Joseph could help to provide a follow-up to all the parliamentarians here so that we have material to use in parliamentary questions and debates. So again, thank you all very much for attending, and please take care and stay safe.